Hey everyone, my name is Dr. Kelly Peterson, also known as the Belly Whisperer. I'm going live on my TikTok and my Instagram. I'm going to answer some questions. I'm getting a lot of really good questions recently, so I kind of wanted to go on and clarify a couple of things. If you have a question, put it in the Q&A box and I will get to it as soon as I can. You can also just message in the chat and I'll try to answer it as we go. But what I came on here to talk about is how to heal your belly. So I've been getting a lot of great questions. What is the online program? Do you offer online appointments? Do you offer in-person appointments? So I'm going to kind of go over everything. For those of you who don't know me, I'm a physical therapist. I'm a doctor of physical therapy. I specialize in pelvic, visceral, and orthopedic physical therapy. I have the Belly Whisperer method. It's an online program. It contains 22 videos with breathing, posture, flexibility, strengthening, and information on scar tissue mobilizations. Let's say you've had a C-section or you've had gallbladder surgery. Offers a lot of information with that, as well as 16 home exercise programs, 5 additional handouts, education on diet, different habits, how much water to intake a day, how much fiber to intake, just common questions that I get asked and information that I provide a lot of my patients with one-on-one appointments. So people always ask me, is this method going to work for me? Should I buy it? It's a lot of money. Is it going to help me? And the answer is, what does it help? It helps a lot of different things. So the reason I created the method is because my time as a healthcare professional is really limited with one-on-one care. I love treating people in person, and if I could, I would want my hands on everybody, but unfortunately, it's just too difficult. So I created this program basically going through what I teach somebody in a 4 to 8 week period, meaning if you were to come in maybe once a week for 6 to 8 weeks, this is all of the information and this is the progression that I go through with my patients. So when you're first coming in, we're focusing on breathing. Once you've got your breathing down, okay, let's focus on postural habits. How are you sleeping? How are you sitting? How are you eating? Are you slunched over? Are you like this? How are you carrying things? So a lot of postural education, really beneficial. And also I include a pregnancy pillow, so if you're somebody that is pregnant or postpartum, it's fantastic. Love that portion. And then after we go through the posture, it's working on flexibility, range of motion. If you are somebody that's had a C-section or an abdominal surgery, do you have scar tissue that's limiting or restricting you? So we talk a lot about that. And then once we've gotten that range of motion, that flexibility back, then it's going through strengthening. How do I activate my transversus abdominis? How do I work on my core? Especially if you're somebody that has an abdominal separation, a hernia, if you have core weakness, if you have constipation. A lot of people think that if you have constipation, it's all about diet, it's all about, water, medications, all of that, but it's also about your core. Can you activate your core? That's a huge one. So there's a lot of videos on that as well. And I break down if you're somebody that's pregnant, especially if you're in your 3rd trimester or newly postpartum, there are a lot of great handouts for people, and there are modifications for pregnancy, especially in the 3rd trimester when you're supposed to avoid the supine exercises. So all of that is included, as well as a thorough guide going through exactly how to follow the program and what you're going to do every day and every week. A lot of people are concerned with how big the program is, but honestly, if you spend 5 to 15 minutes a day doing this method, doing this program, you're going to notice a huge difference. Most of my patients see a major difference within the first time they practice the breathing. Just watching the videos and me going through the anatomy, why the diaphragmatic breathing is important. A lot of people just find relief with that because they've realized that maybe they're a paradoxical breather or a reverse breather. Maybe they breathe with their shoulders. Maybe they flare their ribs. Who knows what you have issue going on. But I talk about all of the abnormal ways to breathe, how to breathe, why it's important. So yes, the method is extensive, but it's so crucial. And I'm going to take you step by step through it. So, and then as well, the awesome part about it is if you're somebody that suffers from constipation, there's a pooping video. I think I'm on the toilet for 10 or 15 minutes talking about different techniques for pooping, things to avoid, how to inhale, how to breathe, using small movements. So it's really, really important. And then I have a guide that goes along with it to show you how to do colon massage, So if you're somebody that has constipation or bloating, a lot of people don't know what's causing their bloating. And if you've had all of those tests, right, if you've had allergy tests, if you've seen multiple doctors, even specialists like a gastroenterologist, and they've done, an endoscopy or a colonoscopy, and everything is coming back negative, and you're really frustrated and you feel like, oh, everything is in my head, don't worry, it's not in your head. You probably are really bloated and having these issues, but maybe you don't have an actual systemic or inflammatory issue going on. Maybe it's more of a mechanical issue, and that's where physical therapy comes in, where my method comes in. I'm focusing on the mechanical aspects of bowel movements, not just taking medication, eating, all of that. How are your muscles contracting? How are you breathing? How are your tissues moving? A lot of those things play into how well you have a bowel movement. So for a lot of people that suffer from chronic bloating, sometimes it's literally just constipation. And once you figure out what's causing that constipation and how to fix it, it's night and day how much better you feel. And you'll notice it right away. A lot of us who suffer from, like me, irritable bowel syndrome or some type of stomach issue, you feel best right in the morning typically. And that's because you haven't eaten anything and your stomach's empty and you feel really good. So it really is hard for you to want to eat something sometimes, because once you take, let's say you just drink water and then all of a sudden your stomach blows up, which can cause a lot of fear with eating, which then leads to an eating disorder or disordered eating. So I understand how frustrating bloating and constipation can be, but I'm telling you, if you follow along with my method, you're going to learn a lot about different techniques to avoid that and how to treat that. And what's nice about the program is it's all at home. So if you're somebody that's really busy, you don't have a lot of time, you can watch it. You print out all of the handouts, and all of the home exercise programs are downloadable. People have been asking me, how long do I have access for? Right now, the program is extended for the next couple of years, and all I have to do is extend it longer. So if you're somebody that has, is wanting to use it now and then you need it 5-10 years later, you could just email me and I can extend it. So I just have it up there for 2 years because that's what the Teachable app told me. But you have access to be able to download all of the handouts and the PDFs, so you won't lose those. Just the videos are embedded for safety, so copyright issues don't happen. I've been getting that question a lot. So highly recommend looking into the program. I just want to make sure nobody's asked me a question. Okay, great. Now, everybody else that wants to know about in-person appointments. So I live in Orange County, California. I work at a clinic 4 days a week, and I treat patients there, right? I take insurance, but with my business, it's all cash-based private practice, because it's just me. I don't have the ability to handle all the insurances right now. If you want to see me in person, I treat on the weekends. I'm looking into maybe extending some of my hours for people during the week, maybe after 6 p.m., for people to come and see me after work. I know the weekends can be difficult for some people, but right now I'm treating in person Saturday and Sunday. If you want to see me, the first appointment and his evaluation, it's $195, and follow-up appointments or subsequent appointments are $165. So when people tell me that my method is really expensive, I say it's a lot more affordable than having an appointment. If you see me 1, 2, 3 times, it's going to be much more expensive than the method. And right now it is on sale. It's $150 off right now, so it's only $250. And then I'm thinking about bringing it back up to $399 in November when the sale ends. So if you're interested in buying it, look into it. I also offer a monthly payment plan. I understand that finances can be tight. So if you're somebody that doesn't have the money to buy the full program straight out, that's okay. You can buy the monthly payment plan. Basically, the 5 B's of my method: belly breathing, belly posture, belly bending, belly bracing, and belly buddy. You're gonna get access to each of those after 1 month. So you're just gonna pay that monthly fee. So once you've gone the 4 payments, then you'll have access to everything. So it's basically the same program. You're just getting it what they call dripped. That way it's just coming with the payments. So just as good, and it's a lot cheaper. So if you have any more questions, you can look on the website about that. If you are not local and you are out of the country, you are out of state, I do offer online consultations and appointments. I offer a 30-minute one and a 60-minute one. I was offering a 15-minute one for like $20 or $25, but people kept canceling and no showing, so my time is really limited, so I ended up getting rid of it, unfortunately. I might bring it back for people, but for right now, I only offer the 30-minute and the 60-minute appointment. And a lot of those appointments are available on Mondays and as well as Saturday and Sunday. So I try not to do too much Tuesday through Friday because I am treating patients in the clinic, and it can be a little draining to be working, 2 full-time jobs. But like I said, so many free resources. Also, if you're looking for perineal massage information or pregnancy, I offer free videos on all of that on my website, as well as information on how to test your pelvic floor for Kegeling or pelvic floor strength and motor coordination. There's a free video there. There's videos on how to use dilators, how to use pelvic floor wands, scar tissue mobilizations, colon massage, taping for hernias or during pregnancy. And I have the webinar that I did recently is still up. It's the 52-minute webinar talking about how do I check for a diastasis recti or a hernia, and then also what are the different treatments, how to go about that. So I have a whole 52-minute video answering a lot of the questions you guys have been putting online with a lot of my videos, so check that out. That's still available. I will be doing some more webinars coming up. I'm thinking about doing one on painful penetration and sex because I've been getting a lot of questions about that, and treating painful sex is one of the most common things that I treat in the clinic, along with constipation and bloating. So what do you need to look for in determining a good doctor for out-of-state people? Great question. Everybody is going to be different. So like I said, I'm a physical therapist. So if you're trying to find somebody like me that does pelvic floor therapy and then visceral, meaning manipulation of organs, soft tissue, fascia, there is a free handout on my website with different hyperlinks, the APTA, American PT Association. I put Pelvic Guru. There's a couple different links to find a specialist near you. But to be honest, you're going to want to go with word of mouth or recommendation by your doctor. Sometimes it can be really difficult finding a specialist for you because some people don't really like to treat the stomach or the pelvic floor. They don't really know how to, or they don't like to. So then when you come in, they're kind of thinking, oh, I'm just going to try to do other treatments that normally work. Let's say if you're a low back pain patient. So they may not actually do internal assessment, or they may not do a lot of stomach assessment. So you may want to call ahead before booking an appointment to find out what kind of specialties or what different therapists offer at your clinic. But if you're somebody that has any type of pelvic floor or abdominal issue, I usually recommend seeing for pelvic floor issues more of like a gynecologist, an OBGYN. You can also see a reproductive specialist if you're somebody that's is having difficulty with infertility. If you're somebody that's having more like stomach issues or hemorrhoids or bowel issues, then you want to see a gastroenterologist. There's urologist as well. If you're like so overwhelmed with me dropping all of the different types of specialists, just start with your primary doctor. Starting with your primary doctor is a great place to start. They're going to give you recommendations. Also, your primary doctor is going to know your insurance, so they're going to know whether a specialty provider is in network with you. That's something that's really important to know, because if your doctor is out of network, it may be expensive to go see that person, so you may be paying all cash. You really want to find out that information. It's going to vary depending on the state you're in, depending on the insurance that you have. Everybody's different. And some pelvic floor visceral therapists only are cash-based, like my business, because it's very small right now. I think is a hernia. So the question is, it's what I think is a hernia or a diastasis. I just had a urethral sling put in on Thursday. Any advice? Ooh. There's so many things I want to give you, but book an appointment online if you want more specific one-on-one. My advice is to see a pelvic floor therapist immediately to learn on different techniques to make sure you protect the surgery site, you don't bear down, bowel and bladder habits, postural habits, how to get in and out of bed, avoiding lifting. So there's a lot of different information that I want to give you, but book an appointment for that. I don't want to hijack this live. That's an extensive surgery. So going back to that, like I said, if you're looking for somebody in your area, like I said, starting with your primary doctor is a really good place to start. They're going to let you know who's in your network, where to go, what kind of specialties. And remember, just because a doctor tells you that having a diastasis or an abdominal separation or a hernia is normal after pregnancy doesn't mean it's not treatable, right? Normal and common kind of can go hand in hand sometimes. Is an abdominal separation and a hernia common? Yes, very common, but it's not necessarily normal, meaning if you're having any type of dysfunction or pain, it's treatable. There's so many options and things that you can do, so you really want to look into that. And yes, sometimes your separation can look really, really bad or look like really deep, or you have a lot of coning, or you have a lot of separation, but you have no issues, and it's more of an aesthetic problem. So everybody is different. Sometimes they require surgery in some cases, right? Some hernias, depending on the locations, require surgeries, especially if it is restricting blood flow, or sometimes hernias can lead to bowel obstructions where all of a sudden you can't have a bowel movement. So in those cases, yes, surgery is a necessary thing to get. But like I always tell my patients, if you can avoid surgery or at least get an assessment by a physical therapist before, it's always, always important. They're going to be able to check and assess your strength, your range of motion, your breathing, your flexibility. Now, I can't tell you how many patients that I get that have seen multiple physical therapists that have never addressed breathing. It's actually very shocking to me because a lot of people come in with horrible problems, or they'll tell me, it's been a year since I've had my baby and sex is still really painful, and I'm having pressure when I run, I'm having pressure when I do Pilates, and I've seen 2 different pelvic floor therapists and I'm still having all of these issues. And my question is always, what did you do with your therapist? What did they teach you? What did you do, And unfortunately, everybody is different. So I recently had a patient where the therapist only did internal pelvic floor therapy and then didn't give the patient any exercises to follow up with at home. So and maybe it's because there was a miscommunication between the therapist and the patient, or maybe the therapist really didn't give this patient any home exercise program. But you have to be given a home program to do every day you're not in therapy to help progress, to help you to keep improving. If you're just going to see somebody once a week, but you're not putting in all that homework on the days that you're not there, it's going to be really hard for you to get better, right? So I think that's something that's really important. And so when I saw this patient, I was so excited because this person hadn't been taught how to breathe. They had all of these what I call impairments, or things that were, to me, abnormal, which could be contributing to her pain. I was able to reproduce her pain during the internal exam. So I was excited because I said, look, you're going to get so much better. This is what we're going to do here. This is what you're going to do at home, and you're going to get better. So, like I said, you may need to try a few different physical therapists to find the one that works for you, because everybody's approach and everybody's skill set is going to be a little bit different, and that's okay, right? So just because you see a pelvic floor therapist, or you see a gynecologist, or you see a doctor, and they tell you, oh, everything's okay, or it's normal, well, maybe it's not. Maybe you're feeling these issues and you're trying to tell that to your doctor, but they're not really listening, or they're not understanding. So find that doctor that listens to you, and make sure that when you set your goals with your therapist, you guys are on the same page. I always reiterate that with my patients before they leave. Okay, this is what I'm thinking of doing. This is what you want, right? This is going to be your homework, and this is where we're going to go. And we're on a team together. So your therapist should be your teammate, your advocate. They should be there to help you. And if you're not getting better, they're going to be there to be like, look, maybe we need more imaging. Maybe you need to see this type of specialist. Maybe it's a hormonal issue or a medication side effect. So there's so many different factors. That's why when people ask questions on my posts, I love it. I wish I could answer all of them, but in reality, sometimes the answers to questions that you ask, it's very complex, and there's more medical information needed, right? When I'm doing an evaluation with somebody, if you do an online appointment with me, I have a patient fill out an intake form, right? How old are you? What are the symptoms that you have going on? What prior management have you done? Do you have any allergies? Do you have any other comorbidities or other medical health issues? Are you taking any medications? So there's a whole list of things that I needed to know. And then from there, I'm going to ask you all of these things. What are your bowel and bladder habits look like? How often do you have a bowel movement? What does that look like? What does it feel like? Show me how you do this. Tell me about this. How are you sleeping? How are you sitting? What do you do for work? How are you bending forward? So it's hard to answer questions because a therapist or a doctor is going to, like I said, what I'm going to do today is I'm going to try to get a little more organized because I'm not the most organized person, and I'm going to try to, on my Instagram page, put up in my highlights and my stories a little bit more succinct information on online appointments, in-person appointments, the belly whisper method, a little bit more information. But like I mentioned before, some of the common issues that my method is for is anybody that's pregnant, thinking about getting pregnant, trying to get pregnant but having difficulty, right? If you're having infertility issues, if you've been seeing a reproductive endocrinologist and you're still having struggles, especially if you've had a C-section or maybe a couple C-sections and now you're having difficulty with your third, maybe fourth baby. If you're somebody that has food allergies, bloating, stomach pain, stomach issues, constipation, if you suffer from hemorrhoids, like even if your hemorrhoids aren't actively bleeding, you still have the swollen hemorrhoid, or you're having pressure or skin tags, or you're still pushing or straining to have bowel movements, this method is so important, especially if you also have anal fissures, right? If you have any bleeding, that's another common complaint that I have. If you're somebody that suffers from low back or pelvic pain, even sciatica type symptoms, right? Radiating pelvic pain, shooting pain down the leg, shooting pain in the pelvic region or in the vulva, this method is for you. So it's so many things. I go on and on. Painful penetration, those are some of the most common things I've talked about. I got a question. I need internal trigger point release. Let's see. Yeah, a lot of us need actually internal work. So I tell people ask all the time, what is internal pelvic floor therapy look like? What does it look like when you go and see a pelvic floor physical therapist? So an evaluation is going to look different for everybody depending on why you're going in. But if you give consent and they discuss with the pelvic model what they're going to do internally, they're going to go in and they're going to palpate using their index finger, and they're going to push on different soft tissue structures to see if you have any tightness, if you're having any pain, maybe you have prolapse, maybe you have weakness, so maybe you have hemorrhoids, fissures, so many different things. But internal pelvic floor therapy is really important. To me, it's as important as like TMJ. A lot of people don't realize you can go in internally and you can palpate different muscles, right? Masseter muscle, lateral pterygoid, I don't know why muscles always have funny names. You can palpate these different muscles that help with opening your mouth, chewing, right? Mastication. And you can really relieve a lot of ear pain, jaw pain, neck pain. So many different things you can do with internal. All right, I think I'm going to get off soon because I've been talking way too much about all things pelvic. So like I mentioned, if you are somebody that's really been on the fence with whether or not to buy my method or if it's going to help, I really recommend trying it. I tell people you're going to learn so much information. It has enough information to last you literally 4 to 8 weeks of doing these exercises and these programs. And like I said, this morning I went live on TikTok, and while I was doing my post-workout stretching, and showed just a simple 10-minute way to stretch your pelvic floor post-workout. So like I said, this online program is not something that's going to take up 30 minutes a day, 60 minutes a day. It's something where once you watch it, you can pick and choose. Oh, I really need to work on breathing more. I really need to work on flexibility. Wow, my core is really weak and I need to work on adding more core. And then you pick your 5 exercises that you really need to work on, and you do those, let's say every day, every other day. So I really recommend looking into it. Like I said, It's the same method that I use when I treat patients in the clinic. It's just now a giant comprehensive online program that you can follow along at home. And then, oh, could you please save this? Okay, so I am going to try. Instagram has been funny, and every time I try to save a live, it doesn't work, but I'm going to try to save my TikTok one, and I will post it on my YouTube channel. Oh yeah, also, if you're looking for longer videos, more information, my YouTube channel, I'm going to be posting longer videos there. I'm also going to be starting something new. A patient requested that I start making, 15 to 30 minute workout videos that they could follow along at home, and specifically for pregnancy, postpartum, abdominal separations, all of that. So I'm going to start recording just some basic 15, 30 minute workouts where basically you're going to work out with me and we're going to go through everything that I do in my method and what I teach patients to work on, let's say abdominals, or maybe we want to work on pelvic floor strengthening. So each of them will be targeted towards something. I'll make a prolapse one. I'll make a scar tissue mobilization workout. So it's going to be different themes. So stay tuned for that. Let's see, what program is it? Oh, I'm talking about the Belly Whisper method. Link in my bio, lots of information. I'm going to post this on my YouTube and you can listen to it. And I've just given a lot of information about what the program includes. Like I said, my favorite part of the online program is definitely the bonus videos of me sitting on the toilet talking about pooping, talking about the puborectalis muscle and how that plays a role in kinking and releasing so you can pass bowel movements. I think I got one more question. Are there any contraindications for the method? Who can't and shouldn't do it? Yes, great question. Always contraindications. I have a guide at the beginning of the method. It's a lot of pages, but it goes through different types of precautions, and it has contraindications. Basically, if you're somebody that's pregnant and you are unsure if exercise is safe for you, I always tell my patients, regardless of whatever type of pregnancy you have going on, you always need to ask your doctor, am I safe for exercise and do I have any restrictions? If you don't have any restrictions, right, let's say, for instance, you have placentia previa, right, that would be something where you would need to talk to your doctor because maybe they don't want you doing exercise, right, because when you have that, you can't have sex during that time. So there are certain contraindications. I talk a lot about that too. Also, during the method, I talk a lot about pain. You should have no pain when you exercise. Never should you have pain. I think that's really important. I think a lot of us push through pain. What do they say? No pain, no gain. It's the dumbest phrase. I hate it. But if someone is saying that no pain, no gain, no, it's just pain. Pain is pain. That's all it is. So now if you're feeling muscle burning, your legs are shaking, you're getting fatigued, that's different. I'm talking about, having low back pain when you're planking. That's a problem. Feeling it, if an instructor says, it's normal to feel this in your back and it's hurting, that's a problem. It's usually, unless you're doing back extension exercises or some type of back exercise, sure, maybe you're feeling the muscle work, but if you're having any sharp stabbing, burning, radiating pain, numbness, tingling, those are not normal. So yes, there are different things that would be considered to be contraindications, but I talk a lot about that in my method. So for instance, if you're somebody that's pregnant or in the third trimester, I have a little animation that pops up that says, if you're pregnant, please reference the pregnancy PDF and avoid lying supine on your back, right? Because typically during the third trimester, you want to avoid lying on your back, right? Where the baby's positioning can press and cause, dizziness, decreased blood flow. So yes, that's a great question. But really, like I said, the exercises in this program are typically very safe. A lot of it is breathing, stretching. But yes, if you're somebody that just had a spinal fusion and you decide, to do any twisting, lifting, or bending, those are 3 contraindications typically after surgery, right? If you're somebody that had a hip replacement and your doctor says you can't bring your femur into external rotation abduction like you're getting on a bicycle. So I know I'm going into a little bit of specifics, but surgeries or certain diagnoses or certain diseases, right? Multiple sclerosis, if you have MS, sometimes heat can cause a flare-up. So yes, with any diagnosis, there are always contraindications, right? Do you have diabetes, high blood pressure? Do you have venous insufficiency? Do you have a spinal fracture? So there's so many different things, but typically if you're healthy and safe, the exercise, everything in the program is very foundational and safe, and a lot of it is talking about form and posture. One of the differences with my online program versus other programs you may find online, like workout videos, I'm not sitting there, we're going to do 30 squats. Okay, here we go. Up and down, up and down. No, it's going to be me talking about exactly how to do a squat with good form, with good posture, so you're not putting pressure on your back. So you're activating your glutes so you build up your booty. So it really breaks down. A lot of it is based around safety, right? Because I'm a physical therapist. I'm a movement specialist. So I focus a lot on body mechanics. One of the videos that is a bonus video is all about how to bend forward, how to bend down for lifting. Because a lot of times when people pick up their kids, pick up their laundry, they're doing the dishes, they don't bend through the hips, right? They fold at the back, and that can cause a lot of issues. So it has a lot of really good tips on that. So, and if you are nervous, I have a lot of people email me too. Hey, I have this issue going on. Is it safe? You can always email me. But if you really want to have a more specific answer, please make an appointment online. What I have been doing recently and what I've been thinking about is if you book an online appointment, let's say you book a 30-minute online appointment and then you're really, really interested in getting the method after, then I will waive that fee of paying the $50, right? So if you paid whatever, $55 for the 30-minute appointment, I will waive the $50 to go toward the method if you really want that. So that's in November, I'm going to look into adding that back in once the method goes back up to the normal price. So check it out. Like I said, you can also email me, but if you try to message me, hey, I'm having horrible pelvic pain when my partner and I have sex, and when I poop, it's not coming out. It's going to be really difficult for me to answer all of those questions. So if you're somebody looking for a specific response, please make an appointment. All right, I really, really appreciate it. That was a great question. One more question: is the method also for men? Oh, for men. Oh, yeah. The method is for all genders. The method is for everybody. So I'm really glad you brought that up, because a big misconception is people think that males don't have pelvic floor issues. But, whatever you identify as male, female, neither, everybody has a pelvic floor. Everybody has the same parts. They're just organized differently, right? That's why we look a little bit different. But it's the same parts, similar anatomy, a little bit different treatment techniques when you're doing internal work, right? A lot more internal work rectally for males. For females, I'll go in a little more vaginally or rectally, depending on what symptoms they have going on. But everybody can benefit from pelvic floor therapy. And in fact, I would argue that a lot of my male pelvic floor patients that I see suffer from chronic constipation for years, suffer from ED issues, urinary issues. They go into their doctor saying, I'm having burning when I pee, I'm having difficulty fully emptying when I pee. And even females get the same issue. And a lot of doctors will go, oh, do you have any STDs? Are you sexually active? And they're thinking it's an infection. But when they do a urine analysis and they do a sample, it's not an infection, right? It's usually a pelvic floor issue. It may be interstitial cystitis. It may be tight pelvic floor muscles causing some of those issues. So yes, males and females can have pelvic floor issues, and my method is for everybody. So I treat both in the clinic, and I have done both for online. So look into it if you want. It's even great. My husband is a physical therapist. He's great. He even gets shocked at some of the things that I tell him and what I do, because he can't believe it. But we do some of the stretching together, and I've even taught him a lot about his pelvic floor that he didn't even realize. So yes, everybody could benefit from pelvic floor therapy. Okay, I went a little bit over because you guys had great questions. Like I said, I'm going to try to record this and put it on my YouTube channel for everybody to access. But please look into my method. Like I said, that's why I made it. I made it for people that are not local, that I can't reach. It's it's been really awesome getting testimonials back from people, hearing the feedback and how it's helped them in their pregnancy, how it's helped them with their stomach pain, their bloating, their sex life. So it makes me really happy. Thank you for all the support recently. I've been getting really busy and a little bit overwhelmed, but I really appreciate everybody supporting. Please look into my method, and if you have any more information, if you want more information, let me know. If you're a medical professional and you want a little preview about some of the courses and some of the things I offer, please reach out to me. I offer a discount for all medical professionals, regardless if you're not a physical therapist. If you're in the medical field and you're curious about how this method can help your patients or your clients, let me know. I would love to help out. And yeah, I'm hoping that everybody can learn to have a really positive experience with their pelvic floor. I know a lot of people suffer from, period issues, irregular menstrual cycles, infertility, pooping issues, constipation, and I'm here to help. I want everybody to, be comfortable and feel that they have an outlet for that. So thanks everybody, great questions, and I'll try to do some more lives. I know it's hard with my schedule, but I'm going to try to pop on a little bit more to answer some questions. All right, thank you everybody.